Our initial examination, which includes a history and a complete examination plus a treatment, is $75 for that visit. The follow-up treatments are $35 each, and occasionally if somebody comes in with a new problem or hasn't been in over a year, we charge $45 for that visit. The second visit is usually a report of findings, and that's it takes a little bit more time and maybe a little bit more expensive as well. OHIP doesn't cover this anymore and hasn't for the last few years, but private insurance will cover almost all, if not all, of the treatments in very many cases. So you would have to check with your private insurance cover to make certain of that. We treat mainly neck pain and low back pain and headaches, but we also treat sports injuries, children's problems, we treat WSIB cases, and we do some sports nutrition consulting as well. So we do a number of different things. I use mainly two different techniques. The first technique is called the diversified, and this usually involves the standard manipulation that everybody is familiar with chiropractic. There's an audible release when there's an adjustment, and the second treatment, which is more appropriate for children, senior citizens, people in a lot of pain, is the neuromechanical impulse instrument, and that is wonderful for people who are concerned about the noise of an adjustment, or they're concerned about the pain that may be involved with it. Well, we chiropractors like to say that as the twig is bent, so grows the tree. And essentially that means that a lot of the problems that we have as adults started when we were younger and went undetected. And as a result, we believe that kids, just like going to the dentist, need to be seen by a chiropractor to make sure that the spine is in alignment, that it's functioning properly, and that there are no problems that arise later on in life that could have been easily avoided. You know, a lot of people are frightened of the noise of an adjustment, and certainly nobody has to get anything adjusted that they don't want to. The patient is always in charge of the treatment. We work together to come up with the best treatment possible, but the patient is always in charge. For those people who are frightened of the noise, as I said, we have the neuromechanical adjusting instrument, and that takes a lot of the pain and consternation out of a visit to the chiropractor. I try to consult with my patients right along the treatment plan. Once the pain is gone, we usually make recommendations for follow-up. Seeing a chiropractor is very similar to seeing a dentist. I usually try to recommend that once the problem has disappeared, that we stay ahead of the problem, maybe visits with once a month or 3 times a year, depending on the individual. The patient's always in charge of that, and it makes sense to see your chiropractor just like it makes sense to see your dentist periodically to avoid problems that may come up in the future. Well, I hate to be kept waiting in other people's offices, so we try to book our patients so that there is no waiting. I find that if you're made to wait more than 15 minutes, that's particularly disrespectful of your time. So we try to keep that down to a minimum if we can. Usually the first visit takes about 30 minutes, and depending on the problem and the treatment, follow-up visits will usually take anywhere from 5 to 15 minutes. I usually try to tell my patients that there should be some appreciable positive changes within 6 treatments. But again, there are no guarantees, so we can't promise anything. Most people do walk out of a treatment feeling better each time they come in. So hopefully with each visit there is an improvement. The office has multiple practitioners. We have myself as a chiropractor and a sports medicine specialist. Generally speaking, our office includes chiropractic, workman's compensation, motor vehicle accidents, sports injuries, orthotics, sports nutrition, homeopathy, acupuncture, orthomolecular therapy, kinesiotaping, sports taping, massage therapy, colon hydrotherapy, and first-line therapy for nutritional care and support.